you remember your first COVID vaccine day? Did you have side effects? And the biggest question, can a COVID vaccine side effect become a lifelong illness?
Can a COVID vaccine side effect become a lifelong illness?
Hi friends, I am Deshan Jayathilaka. I am graduate nurse from Faculty of Medicine and Allied Health Science, University of Jaffna. Today, I want to take you back to the COVID season. Not just the science, but the feelings, struggles, and my own health story after the COVID vaccination. This is not a textbook lecture. It's my life spoken from the heart.
The COVID season begins.
I still remember 2020. I was third year nursing student walking through the wards of Jaffna hospital. Suddenly, the world changed. Corona was everywhere. Lockdowns came overnight. No buses, no trains, no foods in canteens. We were far away from our homes, stuck in hostels, scared, but still trying to learn. Every day we wore masks, washed hands until they were raw, and worried about our patients and ourselves too. The hospital corridors felt heavy, like silence makes fear. That was the season we lived through. Then came the vaccines.
The vaccine arrives.
The government said the health staff, members, and students first. No choice. If you don't take it, you can't enter the university. If you refuse, you wait at home for a year. Meanwhile, in Europe, they were testing the vaccines on old adults. But here, we young nurses were the first of the line. AstraZeneca arrived and I had to take it. I thought it just another injection. I never dreamed it would change my whole life.
The first dose reaction.
3 days later of my COVID vaccination first dose, I looked in the mirror. My skin had purple patches on my back, on my thighs, on my shoulders. I thought maybe just bruises. But after day 7, I woke up with blood in my mouth. My gums were bleeding, jelly-like clots everywhere. When I walked, blood came from my nose. Hepatitis. I rushed to the ward. Blood test showed platelet only 10,000. That was the start of my journey with ITP, immune thrombocytopenia. It's a very rare side effect can develop after vaccination of viral infection.
The investigations.
They did bone marrow tests, lymph node biopsy tests, CT scans, several tests. Luckily, bone marrow was normal, but the lymph node biopsy showed sinus reactive hyperplasia. So the doctors gave me several IVIG courses. Other than that, high dose of steroids, few courses. Before this vaccination, previously I was very healthy. I played a few games, football, cricket, like those games, and also I didn't had any bleeding before that. So I told that to those doctors. Even I complained. They told me to go to the second dose of AstraZeneca again. I had to do it after the second dose. Again, even I was on high dose of steroids. Again, my platelet was crashed to 7,000. Only then did they realize this was very serious. However, they stopped the third dose, but by then my life had already changed.
Living with chronic IDP.
From that day till now, I live with chronic ITP. It means my immune system misunderstanding that platelet is a foreign body, and my immune system is attacking to those platelets and destroying my own platelets. For that, I have to suppress my immune system. So I take MMF, steroids, and go for frequent blood checks and other investigations. Because of high dose of prednisone, dexamethasone, my weight has gained, my weight has doubled. I had mood swings. Sometimes I can't tolerate my hunger, diabetes incoming. Other than that, liver function test is abnormal. Fatty liver grade 2 to 3. A lot of problems will rise because of these immune suppressor drugs. Steroid gave me strength, it's true, but also side effects too. Moon face, stretch marks, emotional up and downs, MMF suppressed my immune system but made me vulnerable to infections, especially in hospital. This is the hidden side of vaccination that few talk about. And I'm not alone. According to the researchers, research shows rare side effects after COVID vaccines. Do you have these side effects? Let's see.
Myocarditis, pericarditis.
The most common and frequent rare side effect was myocarditis and pericarditis. After especially Moderna and Pfizer. These vaccines are mRNA vaccines. Imagine that you are a young male, young man. After a few days of your first dose of COVID vaccination, you feel chest pain, shortness of breath, your heart is racing. Doctors call it myocarditis or pericarditis. That means heart inflammation. Yes, most cases are mild and improving the rest and medicine. But for that person who will get this side effect, it's right. And sometimes these heart inflammations may be irreversible.
Guillain-Barré syndrome.
The second most common rare side effects with the COVID vaccine is GBS, Guillain-Barré syndrome. This side effects most commonly related with AstraZeneca and Johnson & Johnson vaccine. Imagine after a few days of the first dose of COVID vaccination, you can feel a tingling start from the feet and climb upwards. Weakness in the legs, sometimes trouble walking. So GBS is when the immune system attacks your nerve system. Nerves. Yeah, it's rare, but it's real. Many improve with hospital care, but those first days are terrifying.
Thrombosis with thrombocytopenia VITT.
The third most common rare side effect was thrombosis with thrombocytopenia. Most commonly, this side effect came because of AstraZeneca, severe headache, abdominal pain, blurred vision, then scan shows unusual clots in your brain, while your blood counts are showing that your platelet count is dangerously low. Yeah, it's very rare again, but it is very serious.
Transverse myelitis. ADEM. Multiple vaccines.
Fourth common rare side effects of COVID vaccine was transverse myelitis and ADEM. These side effects most probably came because of multiple vaccinations like first dose AstraZeneca, second dose Pfizer, third dose Covishield. Like those people got these kind of side effects. Transverse myelitis is inflammation of the spinal cord, sudden heaviness, weakness, or other than that numbness. ADEM inflames the brain and also spinal cord. Confusion, weakness, balance problems arise. Both are rare, that's true, but they remind us the immune system can sometimes fire the wrong direction.
Immune. Thrombocytopenia, ITP.
Fifth most common rare side effect was immune thrombocytopenia, ITP. Most probably AstraZeneca. The one I know too well. Purple patches in everywhere, bleeding, tiredness, weakness, lethargy, nose bleedings, gum bleedings, frequent blood checkings, investigations, immune suppressants, MMF, steroids. With those drugs, again another more side effects. Luckily, most people had only mild fever or sore arms. But for few of us, the story was different. I'm not alone. Around the world, rare side effects were reported. My journey is one of the vaccine saves millions of lives. They reduce severe COVID, lowered hospitalizations, and helped to prevent long COVID. But the rollout was rushed. Governments had little time for long-term testing. We were the front line, and sometimes we were the ones who carried the rare risks. For the majority, it worked. For some, it left scars. My story is one of those scars. So, can vaccine side effects last a lifetime? For most people, no. But for some, yes. I think my disease, ITP, can become chronic. And also, most side effects, I told you, may last your lifetime. And other than that, anaphylaxis, allergic reactions can be triggered after the COVID vaccination. It's very normal thing, and it's very common thing we can see. A lot of people easily getting allergics after these COVID vaccinations. For those side effects, most probably we will use anti-allergens and again steroids. So steroid side effects can be last more than years. The truth is, vaccines are powerful but not perfect. Public health decisions are about population benefits, but behind every statistics, there is a person. I am that person. Thank you for walking with me through this journey. This is only the beginning of my series. I do not stand here asking for sympathy. I stand as a warrior. A warrior who faced a lifelong disease after COVID vaccination and still choose to fight for myself and for you. Even while I struggle, I use my knowledge and my experiences to keep people alive, to empower communities, and to speak the truth about health.